Hello everybody, I'm Kat the Vet and this is my cat Fatty. At the moment in the UK we are now in a lockdown for coronavirus, and although vet practices are still open and ready and willing to help you, we are only seeing emergency or urgent cases. What we're here today to show you is how to do a quick physical examination on your pets at home, and you'll be able to give that information to your vet if you're worried, and that's going to really help them be able to decide whether you are going to need to be seen or not. At the moment I'm on lockdown myself and I only have a cat. So we're going to show you the principles, but actually it's very similar whether it's a cat, a dog or a rabbit. The checks really are pretty much exactly the same, and this information is going to be really useful for both you and for your vet. Okay, so what we do is we start at the front and we work our way to the back. So first of all, the eyes, have a look at them. Are they open? Are they equal? Are they bright? Is one blinky or winky? Is there any discharge, or are they watery? Are the pupils the same size? If you lift up the upper lid, you're going to be able to look at the whites of the eyes, and that should be pretty much white with just a teeny tiny few blood vessels running through it. If it looks really red or angry, we need to know about it. And if you gently pull down the lower lid, you'll be able to see the conjunctiva, which is the pink of the eye. And again, what does that look like? Is it red? Is it angry? It should be a beautiful pale salmon pink. And the eyes, there's two of them, so compare and contrast. Are they the same? Are the whites the same on each side? Is the pink the same on each side? Any difference? We want to know about it. The same with the ears. Ear infections are common in our pets, and you might notice signs of them shaking their head, scratching, or being really reluctant for you to touch them on one side over the other. Again, if you get the ear and just really gently, be careful if it's sore, don't even try, lift that ear flap back and have a look. The skin should be pale, it should be clean, and it should be calm, and it should be the same on either side. Any sort of discomfort, again, pick that phone up. And then finally, at the head, we want to have a look at what we call the mucous membrane. So essentially the gums. What colour are they? So it's easier on flopsy-lipped dogs, but what you can do is you can lift up that lower lid and you can see the pink there just by the tooth. That again wants to be that beautiful pale, we call it a salmon pink, that pale pink. And if you gently push on the gums and lift your finger away, it should blanch, but then it should refill almost immediately. That's called the capillary refill time. Tell your vet about that as well. The next piece of information that's really helpful is a resting heart rate. So when your pet is calm like this, how fast is their heart beating? To find out, put your hand, the flat of your hand like this, and slip it underneath their left elbow till you can feel the ribs underneath. Even with chunky ones, you can definitely feel it. Move your fingers around really slowly and gently, and eventually you will find the heartbeat. You'll be able to feel it beating through the chest wall. And then what you want to do, what I do, is time 15 seconds and then times that by 4. So look at your phone or the clock or something, count how many times it beats in 15 seconds and then multiply that by 4 to get the beats per minute. It's the beats per minute is the figure that we're interested in. We know what is normal for cats, for dogs of different sizes, and for rabbits as well. But for rabbits, it will be really high. So good luck with counting that. If you can manage it, well done. Again, it's a really useful piece of information for us. And the other thing is a resting respiratory rate. It's pretty much impossible to see on the camera, but what you're looking for is the chest moving. Is not the chest moving, it's the flank here. That's where it's easier to see the breathing. And again, just wait till they breathe in and out. Time for 15 seconds and then multiply it up by 4. For pets who are healthy and resting, it can actually be really low. But it's a really useful piece of information. And then the final thing you can do, but it is a bit more of a specialised skill, is you can have a feel of their abdomens, a feel of their tummies. I am not expecting you to diagnose any lumps or bumps or anything inside, but it's really helpful for us to know how your pet feels about you feeling their tummy. So in cats, if you get a cupped hand like this, slip it underneath their abdomen there and just give it a little massage. You should be able to get your hand round and just kind of massage it. This is the movement I'm doing with my hand, like that. And you can see that he's really not that bothered, and that's exactly what we want. He really isn't that bothered, I promise. For dogs, what you want to do is get your hands together like this and go down the tummy like that. So one on either side and just gently feel. I'm not expecting you to find anything specific. What vets want to know is the tummy soft? Is your pet bothered by that? Or are they really tense or painful and resisting your hands? So there you have it, a really quick whistle stop physical examination of a pet at home on the kitchen table, but you can get some amazing information, some really useful pieces of information for both you and your pet during this lockdown. I really hope you found that helpful. If I get to work and get a chance, I'll do it on another species, but otherwise, thanks ever so much, Fatty. You were brilliant. Thanks, guys. Bye.